Hello, I'm Dr. Dennis McKenna. Welcome to another edition of Inside Albany Med. And I'm so pleased today to be joined by Brianna Allen. Brianna, great to see you.
Thank you.
It's wonderful to have you here. You're a respiratory therapist here at Albany Med.
I am, yeah.
And we've been doing these videos for a while now. And one of the things that I love about doing these videos now is that not only that the workforce gets to see them, but then people reach out to me and they say, you know what, you should talk to, in this case they said Brianna, because they said that you're a wonderful employee and someone they love working with and someone that our workforce should meet. So that's why we're here today.
Yes, thank you.
Okay. So respiratory therapist, let's start there. What is a respiratory therapist for those that may not know?
Yeah, so a respiratory therapist, our main job is to protect the airway. We work with anyone from extreme micropreemies to adults, and we get to work side by side with NPs, PAs, nurses, doctors, doing life-saving procedures.
So anything really that has to do with breathing, putting people on ventilators, assisting them through those difficulties. And it's very complex work. You actually trained locally, right? I think you came from our Hudson Valley program.
I did, yes.
And you've been at Albany Med now for over 10 years.
12 years.
12 years.
Yes.
When you decided to come to Albany Med to be a respiratory therapist, what made you decide to come here first?
So the Children's Hospital was a big draw for me, as well as the wide variety of patients that we get to see here.
And we were talking earlier, your primary clinical location is the Children's Hospital.
Yes.
We're going to talk about that in a second. But that's what brought you here. What keeps you here? Why do you stay at Albany Med, Brianna?
Same thing.
Same thing.
I love working with the kids and the babies.
Yeah. Let's talk about that. Now, we have various different locations inside the Bernard and Millie Duker Children's Hospital where you might find yourself.
Yes.
One of those locations might be the neonatal intensive care unit.
Yes.
Right? So we have a level 4 neonatal intensive care unit. For those that don't know what that means that's the highest level.
Yeah.
It's the only one in 25 counties.
Yes.
Babies that are very, very small sometimes spend weeks or months under the care of incredible doctors, nurses, NPs, respiratory therapists. Talk about what you do there. How do you assist with their care?
Yeah, so the extreme micropreemies obviously have a lot more trouble than our term babies, or we actually get term babies too that have trouble breathing, and we can assist them with their ventilation, their oxygenation. We see them through their whole stay. So
when you say micropreemies,
yes,
define that for us. How little are we talking about?
I've seen as little as 390 grams, born at 23 weeks, fit in the palm of your hand.
Right. And in order to assist them with breathing, as a respiratory therapist, you work very closely with everybody else to make sure that they obviously don't have the mechanics to breathe on their own. We have to do that for them. That's that has to be done very, very carefully, obviously.
Yes, everything's measured in centimeters and not, down to the millimeters. And
then we'll transition over to the pediatric ICU.
Yes.
We have the only pediatric intensive care unit in the region. Again, often with patients who come in for trauma or complex surgery or have some sort of cancer diagnosis, and you assist in their treatment as well.
Yes, which is exciting because that's anywhere from, also can be to newborn to 21 years old. So we get a wide variety of patients there too.
How much continuous learning do you need to do in order to stay up on the technology, right? The ventilators that we use, they're changing, right? The mechanics of it, the settings. Talk about how you stay current.
So we have a pediatric educator who keeps us up to date on everything that we need to know and help even educate the nurses to help us out or the doctors. So daily I'm learning.
And then you're often on the floor, and there are children who come in who may have asthma or they may have some other breathing difficulties, and you may set them up with a nebulizer or something. That must be very satisfying because often when you are on the scene, they're struggling to breathe.
Yeah.
That's very anxiety provoking, right?
Yes.
And you can very quickly help them through that. Talk about what that must feel like to see them feeling so much better after you treat them.
That's the most rewarding part of the job. Getting to see a child or baby get better and go home and follow up with them. I mean, even getting invited to their birthday parties afterwards after getting to see them or having to see them struggle through things.
So that's incredible. I was going to ask you that. I assume there are some children in the Children's Hospital that you may have established a long-term relationship with.
Yes.
You may have seen them when they were newborn, and that they may continue to come in the hospital periodically, and you still are part of their journey each time.
I am, yes.
Talk about that. What's that feel like?
Oh, that's probably the most, like I said, rewarding thing that could happen for anyone, not only a respiratory therapist, but a nurse, a doctor. Anyone can say that, because sometimes you're not sure that they're going to make it through some of their hard times, and then when you're out in the community and get to hang out with them for fun, it's just, it's a whole different world to see.
Now, we know very proudly that we have the only children's hospital in the region, and we know that about 90% of all the children who are in any hospital bed in this area are here at Albany Med, but they don't all start here, right? Some of them present to other hospitals first, and they need to come to Albany Med. And the way they get here sometimes is by a transport team.
Yeah.
And we go and we pick them up and we bring them back here. But in order to bring them here, we need to send trained individuals who can manage them.
Yeah.
And you're part of that team.
I am, yeah.
Talk about that transport team, the role you play, and what that must feel like to go out and get a patient and bring them here.
Yeah. So I've been a part of the transport team for about 7 or 8 years. We get to go out for neonatal and pediatric transport. And it's across the region, anywhere. We've flown via helicopter, ambulance, or fixed wing plane. We can go get the kids.
And you've been on all three of those.
I have yet to do the fixed wing, but the helicopter it's crazy. And you never know what you're going to go get, which is the scary part. And then to take them away from their family as a baby, that's a hard part, but to know that they're going to be getting great care is.
And so, are you on call for that? And you get your beeper goes off, or you get a message that says, "Hey, Brianna, we need you. We're going to get somebody."
Usually, it's someone that's in the hospital, but sometimes we have been on call where
but you don't know those calls are coming.
Never.
And my point is, all of a sudden, you're told, "Hey, we need to go get somebody."
Yeah.
Right. And you talked about being in the back of an ambulance, being in the back of a helicopter. I certainly have been in the back of both of those. They're sometimes crowded, and you don't have that familiarity like you may in your own workspace. Yet you still have to provide the care. Dark sometimes, bouncy, up and down, flying through clouds.
It's really cool to be able to do that because we work alongside an NP or PA for the NICU and a nurse for the PICU transports. So it's just you and them who has to provide for this child, and it's so crazy.
And there's that vulnerability, right? And you mentioned that where the parents are not able to be in the back of the helicopter with you. They have to drive and meet you there. What do you say to them? How do you calm them down? How do you assure them that their loved, precious child is going to be taken care of by you and the others?
That's what we say, that they are in good hands and we're going to take great care of them.
Good for you. Good for you. I know another area that you like to spend your time is a place where I also like to spend time, which is up at Double H Ranch. Camp up in the Adirondacks, Lake Luzerne. It's been around for about 30 years. Takes care of children between the ages of 6 and 16, often with medically qualifying conditions. And some of those children are on ventilators. And these children get a chance to experience camp in a way that they wouldn't at any other camp, right? Ride horses, swim, arts and crafts, zip line. And we call that what? What do we call that camp when they're up there for that week?
Inspiration.
Camp Inspiration, right? That's such a great term. I love that term. Makes us think about the great Ray Walsh, right? Who helped us get that going. And talk about what it means to be a respiratory therapist up there, partnering with a family, with a patient to give that kid what really is the one thing they look forward to all year.
There's no one word for that. It's fulfilling and I can't get enough of it. It's an exhausting week, but you feel so good at the end of that week, like you really just help that kid have the time of their life, because we do, like you said, we do things with these kids that they would have never done. And I think it's still just mind-blowing to me what we are able to do with them.
So obviously I've worked in a hospital for like 30 years. I know exactly all the wonderful things respiratory therapists do, but maybe everybody doesn't. So paint us a picture. Name some specific things in your scope of practice as a respiratory therapist that you do.
Yeah, I think a lot of people don't realize how much RTs can offer.
Yep.
Working alongside the NPs, the PAs, the doctors, the nurses, we can perform intubations.
Right. So put a
extubation,
breathing tube into, help them breathe.
yeah.
Take it out.
Take it out. Tracheostomy placements and replacements.
So tracheostomy is a surgical airway where rather than going through the mouth, they may go through the neck.
Yes.
Right.
We can draw arterial blood gases right
Right.
out of the arteries. We can help with bronchoscopies.
So putting a tube down with a camera or a camera down to look at the lungs
Yes.
and figure out what's going on.
We transport patients all over this hospital
Right.
to specific scans and
Right.
tests.
And that's a really important point too, right? Because often a person who's on a ventilator may need to go get a CAT scan or an MRI or go down for a procedure, and moving the patient on a breathing machine is something that you have to do very carefully.
Yes.
And so having a respiratory therapist allows us to
Yes.
move patients to those locations. Yeah, very good.
Yeah.
Let's talk a little bit about the neonatal intensive care unit, and there's something very special that happens there
Yes.
called a reunion.
Yes.
Right? Because the goal is that when the babies come in there, whether they're there for just a few days or a few months, they graduate, they get to go home.
Yes.
But that's not goodbye forever.
No, it's not. Every couple of years they've been hosting the NICU reunion, so they all come back, and our majority of kids come back, and we get to see how healthy they are.
And I understand that you are playing increasingly a leadership role in those activities.
Working on it,
Working
yes.
on it, yeah. And one of the things that you do personally,
Yeah.
which marries your love of your job and your patients with one of your passions outside work, is you make some signs.
Yes.
Talk about these signs that you give to the families.
Yes. A lot of people around this hospital know that those are my signs. I personalize them with their names on it and like an inspirational quote or something that has to do with them specifically, or something that their families are really into. And then I give that to them and they can take it home. A lot of them are bringing them back to the reunion so I can have a picture with them with their signs when they're all healthy.
I'm fascinated by this. First of all, about how big are the signs?
Well, I have one for you.
You do?
Yes.
Oh, I was not expecting this. This is great.
Yeah.
Oh, and I was going to ask, so you paint them?
Yeah.
Oh, very good. All right, so this says something on here,
Yeah.
which is very important to me, and it says, take care of yourself and take care of each other. That's very kind of you. Thank you.
Thank you.
And that, of course, is something that we've been saying for many years on our videos as a way of finishing the video. And it's a way of reminding ourselves that we do difficult, challenging work in healthcare.
Yeah.
But in order to care for patients, we have to be the best version of ourselves, right? Mind, body, spirit. And so we have to take care of ourselves so that we can take care of others.
Yeah.
And you've captured that beautifully. And you have a bicycle on
Yes.
there too. That's wonderful. Oh, that's very kind of you. Thank you so much. And you have a little nice note on the back. So this is an example of the type of signs that you make.
Yes.
Well, this is going on my wall
Thank
in
you.
my office. And I couldn't think of a better way to celebrate this video than to get this from you. So thank you so much.
Thank you. I thought of one more thing that
Oh.
that kept me here, though.
What's that?
My coworkers. That's
Oh,
not nice
yes,
that
of course.
I did. Sorry, I
Of
missed
course.
the best part.
Of course, of course, of course. Yeah, that is the best part. Working with our colleagues is
Yeah.
absolutely the best part, for sure. Well, we're glad you stayed.
Thank you.